Do you give permission to be in this video?
Yes, I do.
Hi, my name is Jenny. I'll be your nurse today. Can you please provide me with your first and last name and your date of birth?
Caitlin Lindo, January 6, 2000.
Thank you. I have washed my hands. I will apply gloves as necessary. I provided privacy. We're going to do a physical assessment today. My patient is alert and awake. Can you please tell me what the date is?
The 23rd of September.
The time?
Around 3:30.
Why you're here?
I'm here for a physical assessment.
And where you are?
I'm in my room.
She is oriented ×4. How are you feeling today?
I'm good.
My patient's mood is good. Her behavior is good. Her appearance, clothing is appropriate for the occasion. Do you have any past or current medical histories that would be a problem with the assessment today?
No.
As in asthma or COPD?
No.
Perfect. My patient's skin tone is tan with pink undertones. Her speech is articulate. Her hair is dry and clean with no signs of parasites or lesions. Her eyes are symmetric. They line up to the tops of her auricles, which means her auricles and her eyes are symmetric. Her nose is midline, which is good. Can you please pull down your lower lids? Her sclera is white with minimal veins. Her conjunctiva is clear with no drainage, and it's moist. Thank you. So now I'm going to begin the eye test. I'm going to have you watch the tip of this pen as I put it in different positions, but only move your eyes, not your face, okay? Good. Her eyes were symmetric and didn't show any signs of nystagmus. Now I'm going to measure your eye, your pupils. About 5 millimeters and 5 millimeters. Her eyes are equal and round. Now I'm going to shine the light into one eye and look for constriction, okay? Your eye constricted. And that one also constricted. And now I'm going to shine them in again and look for a constriction in your opposite eye. There was constriction, and then constriction again. So her eyes are reactive to light. Last thing, I'm going to need you to look at my pen as I bring it towards your nose. Her eyes converged and accommodated to the pen. Now I'm going to do your mouth assessment. So her lips are pink and moist with no signs of cracks. Do you use dentures? Do you still have your tonsils?
Yes.
All right, perfect. Open up, please. Her teeth are white and intact with no signs of dental caries. Her tongue is pink and moist with no cracks. Can you lift your tongue, please? Underneath her tongue is moist and her frenulum is midline. Her cheeks and soft palate are also pink and moist. Here's where I would use a tongue compressor. Can you say ah, please? The back of her throat is pink, no redness, no drainage. Her tonsils are not swollen or inflamed or touching each other, so I would rate them a +1 grade. Now, I'm going to palpate your neck, if that is all right with you.
Yes.
Okay. So her trachea is midline, and there's no signs of masses or lesions. Good job. My patient is sitting upright. She is breathing room air, and two accessory muscles are the intercostals and trapezius. So now I'm going to palpate your back. Can you stand up for me, please? Your posterior thorax. So her spine is midline and straight. I'm gonna have you take a deep breath for me, please. All right, my fingers during chest expansion expanded about 2 inches, which is perfect. So now I'm going to auscultate. So every time I put my stethoscope down, I'm going to need you to breathe in through your nose and out through your mouth. Okay. All your lung sounds were clear in all lung fields. So I can sit back down. I'm going to auscultate your anterior thorax. So again, just breathe in and out when I set the stethoscope down. And again, all lung sounds were clear in all lung fields. So now I'm going to assess your abdomen, so please lay down for me. Her skin color is tan with no color variations. There's no lesions or distensions. There's no pulsations. It is flat. Her umbilicus is inverted. There's no redness or lesions. Do you have any pain anywhere?
No.
Okay, so I'm going to listen. If you had pain, we'd have to end in the quadrant of pain, but since you don't, we're going to start in the right lower quadrant. All your quadrants are symmetrical. Her vowel sounds were about 8 to 10, which is active in all 4 quadrants. Now I'm going to palpate. Do you have any pain in your abdomen?
No.
Do you have any pain here?
Mm-mm.
Any here? Here? What about here? 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 Any pain here?
No.
Any here?
No.
Alright, perfect. She had no pain, no guarding or distension, no grimacing. So now I need you to sit up. I'm going to do a kidney test. So I'm going to put my hand back here. Any pain or tension?
No.
Any pain or distension?
No.
Alright, good. There was no pain or distension. Now I would perform BICS, which is bed in lowest position, items within reach, call it within reach, safe environment. I would put the side rails up ×2 and record and analyze my findings.